Okay, good morning to everyone, distinguished speakers, respected guests, and dear viewers. On behalf of Apollo Excelcare Hospital, myself, Arnab Jyoti Das, I'd like to welcome all of you to today's webinar. We have a host of distinguished speakers who will be sharing their insights with us on the significance of on this day, and hopefully this will become a platform and will set the pitch for a much stronger and better relationship for the future, so that we can coordinate and work on such important events even in the future. It gives me great pleasure, that Apollo Excelcare Hospital has got this opportunity to host such a wonderful event, and all due credit must be given to Dr. Ashish Chauhan, who has reached out to us all the way from Hyderabad, and also our CEO, Mr. Gunjan, a very dynamic professional who has taken the initiative to go beyond all distances and take this initiative to connect with all of you. So I'm sure it's going to be a great pleasure. Looking forward to today's event. Over to you, Ashish sir.
Garima, are you there?
Yeah, I'm there.
Yes, please. Over to Dr. Garima, one of the very vibrant and dynamic socialite and an audiologist who would introduce Lions Club to all of us and the main ethos and motto of Lions Club of Hyderabad, elite doctors.
Good morning, everyone. I'm Dr. Garima. I'm an audiologist and speech language pathologist working in the profession from last 13 years. Last year, we have formed this group called Lions Club of Hyderabad Elite Doctors, and we are around 25 doctors in that group. And the motto of this group is to create awareness about different medical conditions, reach out to people who need assistance or aid, or if to conduct free medical camps. And we have been successfully doing that from last 1 year. We have been touched lives of HIV positive orphanage people, and also we have conducted many food donations camps also. And because this group is specialized for the doctors, so we are able to reach more people in terms of medical care, which is very important nowadays. So Dr. Ashish is our president there. And as we are here today to celebrate National Lipid Day, so just a brief about lipid. It is actually celebrated on May 10th across the world. It is a rare condition in which abnormal increase of the number of lipids like cholesterol or fat in the blood occurs. People from all walks of life can help in working towards creating awareness about dyslipidemia. You can partake by volunteering for the events or letting people know about do's and don'ts of the disease. It is more prevalent in Asian Indians as compared to other population. So as today, the seminar is only about that, as more speakers will be shedding light on this. Do we have Dr. Ashish in our room?
Hi, good morning. Dr. Asolie.
Good morning, Dr. Asolie. Good morning. So I would like to welcome Dr. Asolie, as he's the first presenter today. He's engaged as a medical director of Baptist Christian Hospital, Tezpur, and we can see he has a good team sitting behind him. As viewers, we are very happy to have you with us today, sir. Over to you.
Before I ask Asolie sir to speak, because we have some time, I had experience to be in BCH almost 5 years back. One of the very blessed experience. The kind of work which they do at BCH, Tezpur, is serving the needy and the destitute. So over to Dr. Asolie sir to tell us about everything about BCH, as well as the kind of work which nurses do to build up a hospital and organization as well as society. Dr. Asolie.
Thank you. Am I audible?
Yes.
Okay, good morning. So Glad to be here. I'm Dr. Asolie, and with me are my team of senior nurses. We are from Baptist Christian Hospital. We are a small, medium-sized hospital in Assam, in Tezpur, and we are a not-for-profit organization working mostly among the lower socioeconomic people. We're really glad to be part of this program today. And as Dr. Garima has already said about this day, in fact, this week is International Nurses Day. And so as part of that week, Nurses Day is 11th, but the whole week we are observing International Nurses Week. And as part of that, we were observing a lot of academic as well as non-academic programs. So we were quite delighted when we were invited to be part of this. So we look forward to be learning from all our esteemed speakers. And I'm joined here with our senior nurses, tutors, as well as nursing services. And I just want to reiterate the importance that nurses play in the role of as healthcare providers and also as healthcare educators. And as we have just learned, dyslipidemia is very prevalent in our Indian subpopulation. And though we are from a slightly peripheral setup, we call ourselves semi-urban, we have seen that dyslipidemia as well as all the other NCDs are very prevalent. Earlier it was termed as a disease of the effluent, not so anymore. We see a lot of NCDs and all the associated complications like peripheral artery disease, cerebrovascular diseases. In fact, Assam has one of the highest rates of CVA, and we are actually fortunate to be part of
Okay. Dr. Ashok is a consultant endocrinologist. He specializes in diabetology and other endocrinal disorders. He's an associate professor in Guwahati Medical College, and he's a visiting consultant in Apollo Excelcare Hospital, Guwahati. He's a member of quite extreme organizations like Endocrine Society of India, Physicians of India, American Association of Clinical Endocrinology, and American Diabetology Association. And he's also a treasurer for Assam Endocrine Society. He has a number of publications on his name, and he has delivered lectures in several prestigious CME organized by various societies. We are very delighted to have you among us, sir. Floor is over to you.
Thank you, Dr. Garima. Very good morning to all of you. Let us share my slides first. Am I allowed to share my slides?
Yes, please. We are really looking forward to those slides.
But the host has disabled. The host must enable me to share my screen.
Arnab Goswami handles everything in his hands everywhere.
Arnab, please allow me.
Yes, sir. I'm just looking.
Make me a host, then I can share my screen.
Yes, sir. Now you can.
Okay.
Is the option available now, sir?
Yeah.
Okay. Thank you.
I think my slides are visible.
Yes, sir.
Yes, very much, sir. Thank you.
Yes, sir.
Very good morning to all of you. At the very outset, I would like to thank all of you for giving me the opportunity to talk in front of such a learned and august gathering. So when I was told to have few introductory slides in today's program, actually I was not aware of this. I was told only yesterday evening. So I was at a loss what to speak, because I know that the gathering not only include doctors, but also nurses, paramedics, the other social workers and persons from NGOs. So I try to limit my presentation as simple as possible without going into the scientific details of all the lipid metabolism. So if we see that already Dr. Garima has mentioned that every year the National Lipid Day is observed on May 10th across the world. It basically observed to increase awareness about the burden of dyslipidemia and the importance of dyslipidemia in health and diseases. And it was first observed in India in the year 2015 by Kunjan Singh and Sanjay Shuri on behalf of Zaida Kedila. And it is very alarming that dyslipidemia is more prevalent in Asian Indians as compared to Caucasians, because we have an idea in our mind that all the metabolic disorders are more common in Caucasians and Western population. But we know that now the trend has changed, not only for diabetes, but also for dyslipidemia. We know that India is now the second largest country in the world in terms of prevalence of diabetes, and they are not far behind in terms of dyslipidemia also. So we have a huge burden on dyslipidemia. So what do we actually mean by dyslipidemia? Dyslipidemia is just a simple definition is that it refers to an unhealthy or an abnormal levels of one or more kind of lipids in blood, which is somehow we mention it as a fat, but more scientific name is lipid. Lipid and fats are more or less synonymous. It may be increase in the level of bad fats, or the level may be normal, but sometimes some abnormal fats gets accumulated, so that also can causes dyslipidemia. We all know that this is one of the important causes for atherosclerotic cardiovascular diseases. By the term atherosclerotic cardiovascular diseases, we means basically the heart attack, which is known as myocardial infarction in medical term, the stroke or the CVA, the peripheral arterial diseases, and some other conditions which may not be included in the atherosclerotic cardiovascular diseases, but they are also more prevalent in patients with dyslipidemia, is the prevalence of acute pancreatitis or fatty pancreas or fatty liver diseases. So basically, when we measure the lipids in our blood, we basically talk of three types of lipids. One is the LDL cholesterol. I'll come to that. What is it? It is termed as the bad cholesterol. That means the higher is the LDL cholesterol, the more you have the chance of developing a cardiovascular disease. Whereas HDL cholesterol is said to be a good cholesterol because it helps in removing this bad cholesterol, LDL cholesterol, from our body. So a high HDL cholesterol actually protects us from heart attack. And last but not the least, there is another kind of fat in our body, that is the triglyceride. So to have a basic understanding about what is cholesterol and what is triglyceride, before that, let us see the burden of the disease. You can see that there's a rising trend in the risk of or the prevalence of dyslipidemia, because this elevated bad cholesterol, LDL cholesterol, was the 5th leading risk factor for death in 1990. But in 2019, it became the 8th leading cause for death. And so during the last 3 years, the burden of dyslipidemia has increased by around 50%. And globally in the year 2015, it caused around 17 million deaths. And by statistics in 2018, there are 1.5 billion prevalent cases of dyslipidemia, and it is becoming more prevalent in relatively younger populations also, like 20 to 30 years, as compared to the older population earlier. And it has been forecast that the number of people with dyslipidemia will increase to 1.7 million by the year 2020. So there will be a definitely huge burden of dyslipidemia all over the world. If we see the Indian scenario, you can see that it is also increasing in the rural subjects. Although in the urban it is still high, but you can see the percentage of rural subjects who are suffering from dyslipidemia, because we think that rural subjects are somewhat resistant to develop dyslipidemia. It is more common in males, but females are not always protected. They do have a chance of developing dyslipidemia. As I have already said, the more prevalent age group is 30 to 40 years, but it may be happening as young as below 20 or above 60 years. So if we see the lipid profile lipid in a blood, it is basically given in the forms of two lipids. One is the cholesterol, that is the total cholesterol, and the triglyceride. Total cholesterol can be divided into 3 types. Our importance is mainly the LDL cholesterol and the HDL cholesterol. LDL is the bad cholesterol, whereas the HDL is the good cholesterol. And triglyceride is the another entity of lipids which we measure. Now, this total cholesterol, basically the LDL cholesterol, is associated with development of atherosclerotic cardiovascular disease, whereas high triglyceride, they are not directly associated with cardiovascular diseases, but they are associated with a risk of acute pancreatitis. So now we are saying that we have an idea that lipids are always bad, but it is not. Lipids are generally, these are present in our body. They constitute around 15 to 20% of our body weight. So 15 to 20% of our body weight is given by the fat contents, rest are given by bones, muscles, then the visceral organelles like that. So if we see the lipids, they are mainly divided into two types, simple lipids and the complex lipids. The simple lipids, one is the cholesterol, as I have already mentioned, and one is the fatty acid. Now, what is triglyceride? Triglyceride is a complex acid. It is same like fatty acid, but it is combined with glycerol. So 3 fatty acids plus 1 glycerol, that is triglyceride, or also known as triacylglycerol. So fatty acids and triglycerides are synonymous. The most important thing is in our body of all the lipids, 95% is the triglyceride, which is stored majority in the adipose tissue. So the fat content is basically the triglyceride in our fat cells, that is and also in the liver. Now, one important thing is that the triglyceride content of our body differs from person to person depending on the diet. So if we take a more saturated fatty acid, our triglyceride content or our fat content will have a more of a saturated fat. If we consume more of an unsaturated fat or polyunsaturated fat, our triglycerides will have a more of a unsaturated fat. Like butter, if we take butter, it contains lots of saturated fat. So our fat will contain lots of saturated fat, which is basically bad, we all know. Whereas if we consume more of an unsaturated fat, it will be deposited in the fats as a good fat. That is the main thing. And regarding cholesterol, if you know that cholesterol, actually, it is not needed from the diet, because all the cholesterol can be synthesized in the body. And why cholesterol is needed? Because cholesterol is one of the important constituent of our cell membrane, that is the plasma membrane. It is one of the important constituent, and it is also responsible for synthesis of number of hormones like androgens, estrogens, the vitamin D. These are all cholesterol based chemicals in our body. So we must have a cholesterol in a permitted amount that can be synthesized in our body. But the problem is that since we people take lots of non-vegetarian diet, all the non-vegetarian diet contain this cholesterol, and they are incorporated in the body, which is actually not needed because it can be synthesized in the body. So some of the sources of cholesterol are red meat, the egg yolk, whole egg, liver, kidney, and etc. So if you see the fatty acids, I have already told that good fatty acids are there and bad fatty acids are there. So some of the sources of bad fatty acid, that is the saturated fatty acids, are the coconut oil, the butter, the ghees, the cheese, the red meat, beef, chocolate, etc. Whereas monounsaturated fatty acid, which is somewhat good, is olive oil and canola oil, and the best fatty acid is known as the omega-3 fatty acid, or we all know that the importance of omega-3 fatty acid, which is basically obtained from the sea fish like salmon, cod, mackerel, tuna, etc. So if we can consume more of a unsaturated or polyunsaturated fat instead of saturated fat, we can actually decide our triglyceride content. So I'll not go into these details, but just have an idea what is the level above which we are alarmed. So if a cholesterol level is more than 240, it should be labeled as high. The desirable is less than 200. So in between 200 to 240, it is an alarming sign. So more than 240 is a target where the treatment is warranted. Similarly, triglyceride, more than 150 is normal. And if the triglyceride content is more than 500, this is termed as very high, and it increases the risk of acute pancreatitis. So any triglyceride more than 500 must be treated urgently to reduce the risk of pancreatitis. Now let us come to this dyslipidemias or hyperlipidemias. So it is not that dyslipidemias are always related to diet, because 5% of the dyslipidemias are familial. because of some mutations in the genes or the enzymes which are involved in fatty acid metabolism, we can have hyperlipidemias, which are familial, but they are more prone in children. Like in a children less than 10 years, less than 5 years, you can have a very high cholesterol, more than 500, which is normally less than 200. It should be, so it is more common in children. So if a children or a child is coming with a very high cholesterol level, we have to think of primary familial causes. But these are fortunately very rare. Most of the causes are secondary. These secondary are maybe because of some diseases, the most common being the diabetes mellitus, hypothyroidism, chronic kidney disease, and some drugs also like estrogen, progesterone, some thiazide diuretics, beta blockers, they all may increase the level of cholesterol and triglyceride. And some bad habits like excessive alcohol consumption, cigarette smoking, sedentary lifestyles, because we are not allowing our fats to mobilize, they also leads to increased prevalence of secondary dyslipidemias. So the problem is that dyslipidemia can only be diagnosed by laboratory evaluation. You don't have any much of the clinical presentation of dyslipidemia. You can have some associated condition like dyslipidemia, people may have a diabetes or high blood pressure, but you do not have some particular symptoms which are basically of lipid abnormalities only. But these are some manifestations. If you see the retina, you can see this yellowish kind of deposits in the retina, which is known as lipemia retinalis, which is seen in states of high triglyceride. These are known as eruptive xanthomas. You can see these eruptive things with a central, central dip. This is also a feature of hypertriglyceridemia, whereas increased level of cholesterol leads to this arcus senilis, that is, around the cornea, you can get a whitish circle, and you can have all these xanthelasmas also, which you all know. Then we can have some tendon xanthomas. Here you can have this tendon xanthomas. So these are more related to hypercholesterolemia. Now, how to manage this? As I have already mentioned, there is no diagnostic, there is no clinical features. So we have to have a high index of suspicion, and we should have a regular screening of high-risk patients. They're like people with diabetes, people with hypothyroid, people with nephrotic syndrome, some people using this particular drugs. They even
Alka, can you just introduce the speaker, please?
Yeah, a very warm welcome to Professor Ramana Devi, the former Dean of Osmania University. I'm very happy to welcome Madam Ramana Devi today on National Lipid Profile Day. Madam Ramana Devi has received fellowship from various sources like ICMR, Andhra Pradesh. She has published 45 research articles. Her field of specialization is hemoglobinopathies. She has presented several scientific papers at national and international level. She has visited many countries like US, Mexico, Germany, Singapore, etc. She has got selected by the Rotary International as a member for Group Study Exchange Program. We welcome Professor Ramana Devi to enlighten us with her wide experience today. Welcome, Professor Ramana Devi.
Thank you very much. I'm very delighted to be associated with this today's program on a National Lipid Day function. So the topic which was given to me was diet to lower the lipids. So usually, too much of anything is good for nothing. This quotation saying that anything in excess will cause damage. So that is the reason, always lipid has got many beautiful, lovely properties. How we look beauty is also a contribution of lipid, we should understand as ladies. And the key points today I'm going to discuss are how to reduce the lipid through diet. What type of diet to be taken to reduce our fat, which is accumulated in our body. So the first thing is we had to eat heart healthy food. Heart means, it is the important thing which circulates blood and all that. So that is the reason we have to eat the healthy food for our heart, which comprises of vegetables and leafy vegetables. And number 2 is reducing consumption of saturated fats. And the third point is eliminating trans fats. Usually, the animals in their gut, the microbial flora, which produces trans fatty acids, which are very dangerous to our human body when these animals as meat consumed by the human beings. And the third point is eliminating the trans fats. And similarly, we had to eat foods rich in omega-3 fatty acids. And also we have to increase the component of fiber foods in our daily food. In addition to that, we have to increase the quantity of whey proteins as well. So the topic is with diet, how you reduce the fat. So that is the one I have listed out these important points. And coming to the normal pattern of lipid profile, as one of our colleagues already mentioned, the levels of cholesterol to be less than 150 milligrams, which are normal. If they go beyond 150 to 250, it is under the dangerous range where we suffer with related disorders of the heart. Now coming to the concentration of triglycerides, they should be below 150 milligrams per deciliter. And if they also go beyond 500 milligrams per deciliter, it also contributes to the heart-related disorders. And as you know, the low-density lipoproteins and high-density lipoproteins should be less than 100 milligrams and less than 50 milligrams consequently, and they should be also maintained in normal diets. Now coming to the major effects caused by the intake of lipids, there are two different effects. One is general effects and the other one is the heart effects. And coming to the general effects, fatty liver formation, obesity, diabetes, and hormonal imbalances will crop in if the lipid content in the body is increased. Coming to the exclusive effects of these lipids on the heart, number 1 is cardiovascular diseases, and number 2 is atherosclerosis, and 3 is very important one, inflammation cascade modifications will develop inside the body if the more amount of lipid is there in the blood circulation. Now coming to the some more important things, like, I want to just conclude this. The first point is consumption of vegan diets. Nowadays, the vegan diets are produced by different vegetarian foods like leafy vegetables, and leaves. We are extracting the protein things and then we are supplementing, and the milk products are produced like coconut milk, soya milk and things like that, which are again made milk products, and they are supplied exclusively vegan diet. So that is very good for our health. And we have to decrease the level of non-vegetarian diet so that the amount of this cholesterol-based and trans fatty acid will be reduced to our body. And in addition to diet supplements, we have to practice yoga, exercise, yoga nritya. This is yoga nritya is the latest thing, people got bored of doing yoga all the time. That is now transformed to yoga nritya. So it's a kind of dance which also reduces the body weight and body fat related material from our body. And also we had to release the stress of our heart and brain by doing meditation for some time daily, 10 to 15 minutes. And as one of our colleagues also mentioned about the lifestyle changes, the sedentary pattern of lifestyle should be changed to always active and doing something. And one should not continuously sit in the chair. Like that, the lifestyle changes also to be introduced and welcomed into our lives. And also, very recently, the Nobel Prize winning article, intermittent fasting, also aids in reducing body fats as well as increasing the lifespan and decreasing the obesity of the body. This intermittent fasting also contributes a lot to day-to-day life. And things like, very recently, most of us got affected with the COVID, and we have used some specific things to reduce the infection of the lung. And also this helps in reducing the fat content and beneficiary effects to the body in terms of lipid consumption, like, use of curcumin, use of garlic, use of eugenol, like ginger, and use of lemon juices also contribute to the lessening of the lipid and control of the lipid in our body. And use of foods such as which are rich in omega fatty acids, polyunsaturated fatty acids, and monounsaturated fatty acids also will help. In addition to that, the recent research development has also contributed in terms of probiotic supplement usage. So this is the research going on at National Institute of Nutrition right now. And Dr. Amrit Rao is the expert in this field. And probiotic foods also reduce the hyperlipidemia is their conclusion. And above all these practices keep lipids under control, and all the time they are regulated. And I thank the organizing secretary, Ashish Chauhan for inviting me for this lecture. And I also thank Dr. Amrit Rao, you requested me to present. I have not given my experience. I am having 37 years of teaching experience as a biochemistry professor in Osmania University, and I have guided 25 PhD students. And Dr. Ashish Chauhan would know, my student, Dr. Paul, he has done PhD under me. I acknowledge your help to him. Thank you very much.
Big thanks, ma'am. Really, really appreciate those insightful, which message you have given to all of us. I think it was really nice. We definitely will have a couple of questions, but we will do it once we are done with our thing. So please stay with us.
Thank you very much. Yeah.
Thank you, ma'am. Thank you, ma'am. Is Ashish Marandi is here? If we just follow our schedule, we will move to my presentation. And can I request everybody to kindly put on your videos? I request everybody to put on your videos. Okay, I will finish very quick because I really believe that I want everybody's full, involvement with respect to the to today's program. First and foremost, I would want to tell everybody that this program was planned by all of us in order to salute one of the most important part of our, person or a member of our society, that is a nurse. Tell me, what do you call a place where one doctor sits? You call it as a clinic. This is especially for Dr. Asolie's team, whosoever is watching us. One doctor sitting in a chamber is a clinic. Many doctors sitting in a chamber, in 2 or 3 chambers is polyclinic. A hospital is made only and only when doctor has accompanying nurse and there is a treating facility. So a salute to our blessed nurses who take care of our patients, and especially on today's day of lipid control. I would want to give you a kind of a discussion where probably we'll be able to connect how nurses play a vital role in taking care of each one of us and keeping us away from a big morbidity and mortality, which is what scares us all. Who is a nurse and what is her role in controlling lipids? Where do you use the word nurse in English, in simple English? The only place where you use the nurse is nursing mother. A nurse is always seen as a nursing mother. And I would want to tell that is what we need to take care of our patients if they have the lipids. Nursing mother takes care of the food for the child, and a nurse has to talk about the proper food which a dyslipidemic patient should take it. Who is dyslipidemic? Take my words, everybody who's sitting out here. For all the Little Flower degree students and other students from St. Anne's, your parents' diet, you and me needs to take it. Otherwise, a nurse has to take it. And we need to be careful about it. Whatever Professor Ramana told us, we need to remember that. If needed, we'll share these slides also to you. Ma'am has a good slide. So a nurse has to be like a nursing mother. A nurse has to be like an understanding spouse. Few days back, there was a very nice video. I'm very sure Telugu people will know that. There is this nurse who is dancing next to a CVA patient or paralytic patient. And that patient, that bullet dance, which all we remember, and I can see a lot of smiles coming up when we talk about this bullet dance. And that nurse was dancing. Understanding spouse will assure that there is enough exercise, and that's what Dr. Ashok has talked about it. You want to live for 100 years, you need to exercise for 100 minutes per day. Dr. Ashok, I know the guidelines say 30 minutes per day for 5 days a week. In my practice, I have found no pain, no gain. So we do the 100 minutes of exercise per day, 20 minutes morning, 20 minutes afternoon, 20 minutes evening, and 40 minutes of exercise post dinner. That's what we see. So understanding spouse assures that the person is exercising enough. Who is a nurse? You know who we are scared of in our family? The father, isn't it? Father disciplines. The full form of dad is danda and discipline. And a nurse has to be that respected father who is stern about medicine, who cares. If you don't take medicine, I will report to case. There is something called as cheat. There is something called as cheat days. One patient who does not take the tablet, especially if it is a small child, what does the nurse do? She says, if you take the tablet, I will give you a chocolate. And then when you have a 5-year-old boy, 10-year-old boy, whom Dr. Asolie or me are trying to convince for a surgery and doesn't want to listen, we smilingly, we cheat them and we give them, look, this is good for you. And that's what the role of a nurse is. So I salute nurses as they come forward, and we look forward to the 12th of May, the International Nurses Day. And what is a nurse? The final word is Eve is one who connects us to the eternity. Everybody dies. Who doesn't? The only thing is, do we have a hope? And that is what is important. One who gives us the right attitude. We have seen that it's not the problem of death which we handle every day. Why we are talking on the National Lipid Day? Because lipid is the #1 cause of heart attack, which is the #1 cause of death all around the world. The #2 cause of death all around the world is paralysis. Check the statistics and you will know. Death is the truth, but how we meet our creator is what is the job of a nurse. So today, when we are celebrating the Lipid Day, when we are celebrating the International Nurses Day week celebration, me, Dr. Ashish Chauhan, a consultant physician from CMC Vellore and Ludhiana, working at Apollo Hospital, salute you all for being the perfect, person in one's life to give us what we have it. In COVID times, all the recognition went to doctors and the politician and the police. But I know it was the nurse who were working tirelessly who did the job. Me, along with me, Lions Club of Hyderabad, allied doctors, as well as Apollo, Excelcare and St. Teresa Hospital, and all of us, we salute you. And we want your help to take care of our lipid patients, because you are the ones who assure their fitness. May God bless you all. I had an acronym and the slide made for a Lipid Day. But when I saw those blessed, lovely nurses sitting in purple dress in the BCH Tezpur and the kind of work they do it there, I would want to tell you, thank you, for you are the real savior of the society who goes unnoticed. But we are here to appreciate your work. Over to the others, and if there is any question, we will take it. Any question from any students of Little Flowers as well as St. Anne's or anybody else. Take care. God bless. Namaskar. Dr. Garima?
Sir.
Yes. Any question on the chat box, we will be very happy to address.
Sorry,
Hello.
sir, I couldn't hear you.
Hi, yeah, Asolie here.
Yes.
Yeah, thank you so much to all the resource persons for those very, very essential, enlightening presentations. Mine is not a question. My request to Dr. Ashok especially, would you be kind enough to share your slide in the group, because those information were very, very useful.
Okay.
And it will make our life easier to read it through rather than refer the whole book.
Okay.
Thank you.
Okay. Thank you.
So I would like to thank all the esteemed speakers, Dr. Ashok from joining from Guwahati, Professor Ramana Devi, and Dr. Asolie Chase with his team, and Dr. Ashish for taking the pain on organizing, and all the support system, Siddham NGO, Hindi Pratna Sabha, Lions Club of Hyderabad Allied Doctors, Navjeevan Hospital, Kriya Sangh, and here in Say Clinic. I take the pleasure and thank you for joining us today, and we will look forward for more programs like this in future, and would like to educate more and more people. Thank you for all the students who have joined from the Power School.
Thank you.
I'd just like to add
Any
here,
question from anybody?
Ashish sir, I'd just like to add here.
Yeah.
Yeah, I would like to thank all the esteemed panelists and all of you for taking out your valuable time and joining today's session. You know, Dr. Ashish has very rightly pointed out, nurses play a very special role in the entire healthcare setup. You know, without the nurses, the kind of care that we extend to our patients would not have been possible. So I would like to wish all the nurses a very happy Nursing Day in advance. And it has been a pleasure interacting with everyone, particularly my regards to Dr. Asolie from BCH Tezpur. Sir, you're very much welcome to visit our hospital anytime. I am sure we'll be able to collaborate in the future on many such occasions where we'll be able to do a lot of knowledge sharing. Please come to our hospital, visit our hospital. I would like to personally take you around and show you around. And I'll also be visiting Tezpur sometime. So, and thank you to the other speakers, Dr. Garima, Dr. Venkata, Ramana Devi, and everyone. Thank you.
At this time, I invite everybody to take a look at one of the very prestigious institutions we have. It is NIN, National Institute of Nutrition, and Dr. Amrit Rao and Venkata Ramana Devi Madam is there. They will coordinate it. We feel very happy that Hyderabad houses one of so many prestigious institutes of national importance, and collaboration and coordination is what is needed. I would want all the, we have the students of Little Flowers Degree College, one of the very dynamic and a blessed organization is here. We have association with St. Mary's College for Women's, which stands, you know, in the top 10 colleges in India. So this group and this discussion was only made to make sure that we are connected to each other. A big welcome to BCS Tezpur team for Hyderabad. Anytime they plan it out a trip, that will be great, and we'll be very happy to host them in Hyderabad.
Yeah, thank you very much. Yes.
Thanks, ma'am. Thank you.
We will
Thank
be
you.
associated to your organization all the time. My
Yes.
husband being a medical doctor and I being the biochemistry professor.
Fantastic, fantastic. Just to leave a message, Alkaji is organizing something today evening. Alkaji, would you want to announce it here, the slum program?
Yeah. We are organizing this lipid profile day at Kriya Sangh Government High School, and it's a charity program, informative session by Dr. Badri Narayan and Dr. Ashish Chauhan. We would request all of you to please join us for this program. It will be a very informative session along with being charitable towards the society. And I'll share the link here for the program today evening at 5 o'clock. I hope I'm right, Dr. Ashish. It's 5 o'clock.
Absolutely. 5 o'clock is we meet the slums. The idea to communicate is we want to bring the C's together. You know, the community, the corporate, and the colleges, because the kind of jobs which the college is doing at different level, that needs to be connected with the corporate and the and you know, the hospital like that of ours, charitable institutions also, the 4 C's. And that's what the whole effort of people like Alkaji and Marandi sir and team and Garima, we all keep doing it. So stay connected to us through Lions Club. We are trying to bring all the 4 C's together. May God bless you. We'll be very happy to conduct more programs like this, where we bring the whole India, the whole world together, remembering the whole ideology of Vasudhaiv Kutumbakam. Take care. God bless. It was a pleasure interacting with each one of you. Over to Garima for any final words, or to Arnab for anything else.
Thank you, sir. We'll close for today.
Thank you. Thank you.
Thank you, sir.
It was a pleasure.
Thank you to all the
Thank you.
participants.
Thank
Can
you.
you please
Thank you,
share the
everyone.
link of all the discussions so that we can go through it once again so that whosoever could not join, we can use them.
Sure.
Thank you.
Thank you. Good day.
Good.